how can we improve our words, our tone, our whatever we need, nonverbal communication, to make sure we deliver a great experience and not just great dentistry? So we have a culture where we talk about this stuff. We talk about it a lot, and it doesn't feel like you're getting called to the principal's office or you're in trouble or anything like that. Well, that extends to our hard skills too. If we were to see some issue with the quality of dentistry, we talk about it. We talk about it right away in a way. We surround them with the resources they need to improve and go from there. So we're looking for tech solves with AI, but that culture of improvement and accountability and making it okay. I'll be the first one to say, I've done dentistry that wasn't perfect. Every dentist has done that. So let's make it okay to talk about.
Hey there, dental economist. If you're a dentist owner or a leader within a dental business thinking about growing production, case acceptance, patient and staff satisfaction, positive outcomes, and everything else that comes with running a dental business, then you're a dental economist, and you've come to the right place. Welcome to the Dental Economist Show. We're meeting at the intersection of profit and purpose as I sit down with dental leaders who share their stories about dentistry, business, and growth. Welcome back to the Dental Economist Show with me, Mike Huffaker. Today I'm joined by Dr. Chris Salierno, the Chief Dental Officer at Tend. Prior to Tend, Chris was the Chief Editor of Dental Economics. He is also the Chief Development Officer for Cellerant Consulting Group. His extensive career has made him an absolute fountain of knowledge across a broad range of subjects, including consumerism and dentistry, the latest technologies, and how to measure what matters. Welcome to the show, Chris. How are you?
I'm great, Mike. Thanks for having me here.
Absolutely. Really looking forward to this conversation. I've been following Tend for quite some time, really interested and intrigued by all of the things that you all are doing over there. And I'd love to start with a few questions about that. I know there's a lot that goes into this question and probably the answer, but can you explain what dental done differently means?
I had my own practice. It was a startup practice. Back in 2010, I started practice with my then business partner, Dr. Aaron Thomas. And we were trying to do dental differently. We didn't call it that, but we also had this idea that let's try to target certain demographics and create a value proposition for them. So many dentists try to be everything to everybody. You hang up the shingle and say, yeah, we do implant and cosmetic and family dentistry and whatever. And you see everybody. And from your brand, your marketing, your hours of operation, the thousands of decisions that go into who you are, how you're represented, and how you do business, how you serve those patients, all of those decisions just kind of end up looking like every other dental practice. And before I had dug into all the research that I now have been exposed to through dental economics, it was pretty cool. I'll give myself and my partner a pat on the back and say, yeah, we were trying to appeal to a certain demographic. That was busy business people. In Melville, Long Island, we wanted to appeal to busy business people, also 65 plusers. Those were our two target demographics. So our location, our hours of operation, our brand, all of that stuff had them in mind. So years went by, I started lecturing on this material. I still do around the world and try to get dentists to understand, hey, don't be everything to everybody. Be something really special. Really what I'm saying is create a unique value proposition for target demographics. And that's how you fight commoditization. That's how you fight people just haggling you on price. They see and feel the difference every time they walk into your practice or engage with you online. So look, all of that is to say, what has Tend Dental done differently? I was not there when Tend was founded, but there was some parallel thinking there for sure. The genius folks that started Tend, that founded Tend said, let's not be everything to everyone. Our target demographic is going to be young urban professionals. If you're a professional in your 20s, 30s, and 40s in New York City and Boston and DC, that's who we want to serve. Well, now let's build an experience for them that caters to that market. What are the pain points in a patient journey from first hearing about you to making the phone call to walking in insurance paper? Think of all of those little moments. What are the pain points that that target demographic has? And they may be different from what someone who's 65 plus or a teenager or whatever, right? What are those unique pain points? And then how do we uniquely solve them for that market? So when the opportunity to serve as chief dental officer came along and I started to dig in, I had been following them too for a couple of years that they were around. But when they came to me in 2020 and started to talk about the opportunity, I was like, oh gosh, I'm hooked. They're doing stuff that I've been talking about for a long time, and they're executing in a way I never could as a solo practitioner. So Dental Done Differently is, I would say, for your audience, it's creating a bespoke experience, patient-forward experience that's unique to whom we serve, a young urban professional.
So when you look at young urban professionals, and I have some thoughts that just kind of pop into my mind as to what their expectations would be and how it would be different to serve them, what are some of the expectations and how are you solving for this?
It's lots of little things. So let's go through the patient journey. I mean, the way they first interact with the brand. Our chief marketing officer, Matt Fitzgerald, is a genius, him and his team. He came from HelloFresh previously. So please look up our TikTok and our Instagram accounts. I mean, you'll see and feel the brand. That's important. We're already setting expectations for this patient's experience before they ever even pick up the phone. Oh, by the way, that's the next one. They don't want to pick up a phone to schedule an appointment, right? So what are the online booking opportunities we have? Yes, we still have to have them be able to book through a phone, but what are the booking opportunities and scheduling opportunities, collecting insurance paperwork that are minimal touch, digital forward experience? It's also putting them at ease. We notice this market tends to be a little more on edge, right? They're at a critical part in their journeys, urban versus rural. Like there's just a little more stress and anxiety going on, perhaps. So we're very focused on just putting people in a good state of mind. Let's lower that blood pressure. And so there's ways we do that and get them to celebrate their oral health. I mean, an easy example and a famous one that we have is they can select what show they want to watch from our streaming platform. And so when they walk in, it's already up on the screen. As they kick back, there's a screen on the ceiling and they can watch their favorite season 2, episode 3 of their Bourdain show or whatever. And those little things add up to that bespoke experience that they're looking for. Look, some of the big ones are the low-hanging fruit, hours of operation. That's a big one. A young urban professional, some of them will see us at 11 a.m., but yeah, we need to have some evening hours that are open for them as well. So a lot of those 1,000 decisions you make when you're opening or taking over a practice start to snap into focus when you really consider your target demographic and how you uniquely appeal to them.
Are you open extended hours every day of the week? Are you open on Saturdays? What is the kind of framework there?
In New York City and currently in Virginia, we do 7 a.m. till 8 p.m. Monday through Friday. Now we work different shifts, right? Someone isn't working from 7 a.m. till 8 p.m. unless they really want to, but it's 2 different shifts. And our other markets where we're still growing, we go a little bit into the evening, but not yet. And at the right point, we'll pull that lever and introduce some later evening appointments.
Does that make it challenging to recruit clinically?
So it can, but I think if we build it, they will come. If we show them that this is who we're fortunate enough to serve and this is how we meet them there, then it makes sense. What's not fun is working till 8 o'clock at night and not having patients to treat. And you're just twiddling your thumbs. That's not great. Let's build it over time and then we're there. In New York, for example, which is the market we've been in the longest, those appointments are the first to go. We're busy morning through evening and we're able to staff without those hours being a major issue. We also communicated up front, right? It's not a surprise to our teams that they're going to work evening hours. And you know what's interesting? And I've worked evening hours myself in my own practice for a long time. I worked till 8 o'clock at night in my own practice. What's interesting is it's really convenient for your own life. When you work a classic 9 to 5 days a week or whatever, it's hard to get your own chores done and spend time with your family and friends. So I liked having entire mornings and early afternoons to myself before I have to go in for a shift. Or conversely, getting out early, getting out by 2 p.m. or 2:30 or 3 or whatever, a couple days sounds great. You don't mind getting up early. So we find it works.
A midweek morning shopping trip, when it actually works out where it can happen, is a very pleasant thing. Nobody's out there. You get things done quickly. So can certainly see how that could also be viewed as a benefit. I'm curious, with your market being kind of a younger urban customer, if you tend to find that you attract younger clinicians or younger doctors or doctors that also kind of fall within the same demographic of the demographic that you're looking to attract.
That's interesting. We do. So our branding is as a purveyor of healthcare services, but also as an employer. And so our brand, that Instagram, TikTok, who we are, Dental Done Differently, our mission, vision, values, it appeals to a certain type of provider as well, dentists, hygienists, and dental assistants. And we find that we tend to skew a bit younger. We aren't typically taking folks, dentists, right out of school. Hygienists and dental assistants, we do, and we've got a great onboarding program we're really proud of to get them accustomed to our pace. But for dentists, we're usually getting someone who at least has had a residency or a year or two of experience, because this is not easy dentistry. You have to do excellent dentistry. I mean, that's a given in any practice setting. You have to do it efficiently. That's something our busy business patients want, right? They're tapping their finger on their watch like, let's go. They need to be seen efficiently. And then also to deliver this incredible hospitality experience around that efficient, excellent dentistry doing. It's not easy. It's hard to do that right out of school. But we do tend to recruit folks who've been out for a couple of years. Look, there's a certain age of dentists where they've opened their own practice or purchased a practice. So we do have some folks who are more mid-career, which I would be, or even later career dentists that have been attracted to what we're doing.
When you talk about having to practice excellent dentistry, and within your clinics, I believe you call them studios.
That's right. Yeah.
So within the studios, how do you measure or understand the standard of clinical care that's being provided to your patients?
That's of critical importance to us. We have a leadership organizational structure in the studio. We have a position called lead dentist. And if a studio doesn't yet have one in place, we have more senior dentists that we'll rely on. Look, there's chart audits. It's an old-fashioned way to do it. And unfortunately, it's traditionally very manual, although AI is showing great promise in being able to evaluate diagnostic and also execution of dentistry, execution of services in a more automated and equitable way. So that's really exciting, and we're exploring that. But really for us, what I think has been really valuable is setting a culture of continuous improvement. It's one of our values, is rooted in growth, that we're always seeking continuous improvement, that we recognize that we play a role in raising our hand and seeking that improvement, and that we celebrate improvement in others. So one way we do this is on the soft skills side, and your question's on hard skills, but on the soft skills side, we get regular feedback from our patients. We call them members. We get regular survey, NPS, Net Promoter Score feedback from our patients, and we sit down with our providers, we talk about it. And we recognize, hey, maybe we just had a tough interaction with a patient. Maybe the provider did everything they possibly could have to create a great experience. But if we have a patient who just fell short for them and they gave us that feedback, we make it okay to talk about it. Let's role play together. Next time we encounter this exact situation where we're running late or whatever, the crown didn't fit or whatever it is, how can we improve our words, our tone, our whatever we need, nonverbal communication, to make sure we deliver a great experience and not just great dentistry? So we have a culture where we talk about this stuff. We talk about it a lot, and it doesn't feel like you're getting called to the principal's office or you're in trouble or anything like that. Well, that extends to our hard skills too. If we were to see some issue with the quality of dentistry, hey, we talk about it. We talk about it right away in a way. We surround them with the resources they need to improve and go from there. So we're looking for tech solves with AI, but that culture of improvement and accountability and making it okay. I'll be the first one to say, I've done dentistry that wasn't perfect. Every dentist has done that. So let's make it okay to talk about it.
I love that. I think that that's so important, because at first when you're talking about, hey, if there's a mistake or a patient that comes out and has a complaint or leaves a bad review, the initial instinct can be to become defensive. Like, oh, well, I did this, or it was this way, or like this was incorrect. But if you're doing it perpetually, where it's just a part of the motion and the fabric of the company, it sounds like what you've instilled is mistakes are going to happen. Not necessarily like it's okay, like learn from them, but we recognize that it's going to occur. Let's talk about it. How can we move forward? Are there other ways, when you're talking about a culture of continual growth, that is represented within the organization?
So we have our studio team members, and also we call it hub team members. We have two hubs, one in Nashville, one in New York City. The support teams, right, our RCM and call center and finance and all of those departments. I mean, these values are carried through the entire organization. And next week, for example, I'm going to give a lecture to these are non-clinical team members. I've lectured on dentistry. Next week, I'm actually lecturing on public speaking, how they can improve their own ability to present material on a Zoom or in front of an audience. What does public speaking on a Zoom call have to do with doing dentistry? Well, maybe not some direct applications there, but that's part of how we all come together with our various backgrounds and expertise and share. It's not just giving feedback to improve, it's also seeking proactive improvement and making us all smarter. One of the coolest experiences for me when I left my own practice and my position as editor of Dental Economics, when I took on this position, one of the greatest benefits I got was just being surrounded by people who were smarter than me in so many ways. And just being a sponge to speak with a true chief marketing officer, right? I mean, I got into a little bit about marketing. I did my time with dental economics, but oh my goodness. I mean, to pick people's brains and just get smarter is fabulous. So that's how we carry it through the whole organization. We've just got this culture of like, I can't wait to get to my next step of evolution, wherever my career takes me, and let's get there together.
You do so much of the scheduling is done through the app, and your members prefer to book through the app and do things digitally. Managing the schedule in a dental office is like one of the most challenging things I think that can be done. Like in any type of service industry, it's very complex. How do you guys handle same-day dentistry? Any specific approaches or strategies that you have?
Yeah, this is one of my favorite topics. Is building the ideal schedule is a pursuit of excellence. You have a couple days where you look back and go, my gosh, that was perfect. If only every day could be like that. We were busy, but we were also productive, and things got a little hairy there. But then my dental assistant stepped up. I mean, what I always say is that ideal schedule does not happen by accident. It certainly doesn't happen by accident consistently. So look, this is a scheduling business, and all scheduling businesses have inherent complexities, especially when you empower your customers, in our case, our patients, our members. When you give them the ability to self-schedule, that introduces complexity. It's value to them, but it introduces additional complexity. So
it terrifies a lot of groups, by the way. The ability to self-schedule is something that when I'm talking to people, it's often like, no, we can't do that. We cannot let go of any of that level of control.
Meanwhile, like a lot of hairdressers do it, and it's really convenient. And yes, what we do in dentistry is far more complex. I get it. So here's the gist of how we approach it. We do have templates that are in our calendar, in our schedule, and it's a guide. We, of course, this is important. We do empower our teams, especially the dentists, the hygienists. Change that as much as you need. Just because our appointment slot is for 70 minutes doesn't mean you have to use all 70. And if you need to double it, then go ahead and do it. Book outside of that template. The templates are there as a guide, right? They're not there written in stone. We're also very thoughtful about our templates and evolve them. If someone has to book out of template consistently and break the templates, and that means our template isn't serving us well, and we have to adapt it to the needs of our patients. But the templates give a common place for whether it's a call center, a member self-scheduling, us scheduling. It's just a good initial canvas to book appointments. So we use that. And we have, for dentists, 3 different types of appointments, and for hygienists, 2 different types of appointments. For dentists, it's rocks, pebbles, sand is a term that you often hear thrown out there, right? Big, small, and tiny appointments. And we're always having a conversation about that. What's the best use of a pebble? What kinds of appointments should go there? But always empowering our team to do what's right for the patient, to do what's right for the right outcome of care. I have said to our dentists, you will never hear me say, why did you book a 2-service composite in a 60-minute appointment? I mean, if you're doing it all the time, we'll have a conversation. Like, I'm curious, right? But you do it as a one-off, like, I get it. Sometimes there's a 2-service composite that's really hard to do. It's on the distal at number 15 or whatever. Or sometimes you have a patient who needs a lot of TLC. Go for it, right? So not micromanaging, but rather empowering the team to ultimately be the final sayers. And that schedule is what's important, as you have all these different inputs on how that gets in the schedule. They have to be fastidious about reviewing or scrubbing the schedule. So we have some best practices. They'll do it a week in advance. We still have an opportunity to move things around a little bit. But that's really the essence of it, is using templates as a starting point, but then not micromanaging, but empowering teams to be able to make modifications as they need to do the right dentistry.
I'm curious, I haven't asked anybody this question before. What are your thoughts on applying a surcharge to credit transactions when patients are paying their bills and charging cancellation fees when patients cancel their appointments?
So on the surcharge one, do you mean like passing on credit card fees to the patient?
Yeah, like saying, hey, it's going to be a 3% or 4%, whatever the payment is, just added to the bill and the patient covers that.
We're not doing that at 10 currently. I'm asked this increasingly as I lecture. I was just lecturing at Chicago Midwinter, and that question came up when I gave a lecture on profitability and cash flow. I'm not aware of any regulation in any states that says that one can't do that as long as it's properly disclosed. So I'll start with that as a warning to say, hey, just check your state practice act and ask your dental scientist to make sure you're still good. It's a sign of the times, and it certainly can make sense to do it. Personally, my take on this is I wouldn't do it. I'm happy to get paid on time. Whatever the percentage is that you're offsetting, whatever the dollar amount is that you're offsetting by passing along that credit card fee to a patient, it's probably offset by en masse delayed collections because you've made it more complicated or expensive to collect. I'm just happy to get paid on time for the services that are provided. And if I'm concerned about how it affects profitability, then there's other places I'm going to look. And if you're fee for service, then raising fees amongst a whole swath of other opportunities that we have to improve profitability. As far as late cancellations and no-shows, this is a significant problem in dentistry. So Marko Vujicic, chief economist of ADA, has a terrific monthly report that he puts out, the state of the industry. And it's been interesting. This started in the pandemic and having data now for just about 4 years, right? And late cancellations, which is less than 24 hours, or no-shows have been by far the number one reason why dentists aren't busy. It's not that I couldn't find a hygienist to work the shift or any of the other reasons. We had this appointment booked and then someone just canceled it. It's a significant amount, and it doesn't seem to be getting any better. We can speculate as to the reasons why this happens. My recommendation to combat this, I'll tell you what I did in my own practice. In my own practice, we were charging the $50 late fee. And yeah, first time we'll waive it, but second time we really mean it. What I realized from my own private practice was I don't care about the $50 or whatever it is. I just want someone in the chair. And so we had an approach for hygiene, and then we had an approach for restorative. We noticed the hygiene is where we saw the most fall off. And you can speculate why. Someone made this appointment 6 months ago. So let's get a better reminder system in place. So we would have reminders where, say it's 2 weeks out. Hey, please confirm your appointment, or 1 week out, and then a few days. So there was a little funnel there for them. And if we hadn't heard from them after 2 or 3 outreaches, and we now are, say, 3 days out from the appointment, we're starting to become concerned. So we'll send one final message, or typically, I think the warmest way to do it is a phone call. And there's now only, of the 10 patients this hygienist is going to see, maybe there's only 2 that haven't confirmed, 1 or 2 at this point. We then call and let them know, hey, if we don't hear from you in 24 hours, we're going to assume you can't make it, and we're going to have to rebook you. 24 hours expires, we haven't heard from them. There's now 48 hours to put someone in that appointment. And that person has a much higher chance of showing up because they just booked the darn thing. That was a more worthwhile endeavor than trying to charge $50 here and there, because the $50 does not offset the lost production, the wages you're paying to your team, and so forth. So that's my approach that I prefer to see, is a more robust confirmation process, but then also one that says, hey, the penalty is we're rebooking you. We're canceling your appointment. And it was very rare that I had someone still show up. And if they did, we were like, hey, we kind of reached out to you like 4 times. We texted you, we emailed you, we called you, like, sorry.
Yeah, maybe not the best analogy, but in some ways, it's like giving the seat away on an airplane when somebody doesn't check in for the flight. And you're like, hey, we have the seat, we have somebody that wants it, we know they want it, and here you are not expressing that you're actually planning on joining us on this flight, so we're going to go ahead and cancel that. The approach makes a lot of sense. And you said it was really rare that somebody would actually ultimately end up showing. I mean, I figure if it's the low bar to confirm, so it's a much higher bar to actually show up to the practice. If they're not willing to confirm, they're unlikely to show up.
And again, that last message is making it very clear. We don't hear from you by this time. We are canceling your appointment, and we'll look forward to and it's said nicer than that, but that's the gist of it. Hey, we understand, you booked this a while ago and schedules are crazy. We get it. I was just watching a late night show. It was Seth Meyers. I was just watching the Seth Meyers show, his monologue, and he just this week made a joke about how he's trying to get out of his dentist appointment and how that's challenging. And I'm like, yeah, it's a thing. It's totally a thing. A lot of patients try to get out of their appointment. So look, I'd rather use carrots versus sticks. We got rid of the $50 stick and just said, we're just rebooking you. Now you're on a list for us to reach back out and say, hey, let's get you back in. We're not saying goodbye to you and letting that fall through the seams, but let's get a butt in the seat in the next 48 hours and make sure we do that.
So you went to dental school, you opened your own practice. Why did you pursue dentistry initially? And maybe this is kind of a two-pronged question. And it's providing healthcare. I think there's a lot of altruistic desires of initially getting into dentistry. And then there's always the question that comes up, what is the balance between profit and purpose? And so maybe if you can kind of speak a little bit on that from your perspective.
So I got into dentistry. My dad is a now happily retired orthodontist. His brother, my uncle, is a now happily retired endodontist. And I wanted to go into healthcare. Long and short of it is I spoke to my pediatrician back in high school. And I'm like, I'm going off to college. And he's like, what do you want to study? And by the way, this gentleman was probably in his early 70s. This is going back into the 90s now. And he had been practicing since the 50s with like the black bag with the red cross on it and making house calls. Like he had been around in the heyday, right? And he's like, well, what are you going to study? And I was like, I want to be a doctor just like you. And he's like, that's great. Do you have any advice? Yes. Don't do it. That's what he said to me. It's like, your dad's a dentist, right? I'm like, yeah. He's like, do that. And I appreciated the straight talk there. This is someone who had gone from more practice autonomy into, well, what it is today and what it was even in the 90s, where less autonomy. And I don't just mean owning a practice or not. I just mean autonomy. We all know the concerns from the physicians and nurses and the medical team standpoint on volumes and paperwork. And that really is largely still absent from dentistry. And so that's why I went into dentistry, whether I wanted to be my own practice owner or you can be an associate at a practice like Tend, and there's still autonomy. And you don't have all that busy work. You can still take really good care of people and work and use your hands and all that. So look, your question about earning a good living and profitability of the business, reconciling that with also just taking really good care of people was your second question. Yeah, I mean, I don't think those are mutually exclusive. I suspect you don't either. I give lectures, as I mentioned, on profitability and how to increase cash flow through practices. And I start off by saying profit's not a four-letter word in dentistry. And I get it has been. To talk about money and increasing profits felt dirty to healthcare practitioners. And I think it's past time that we make that not a dirty word. We can take really good care of our patients. We can be good stewards of their oral health and also be good stewards of our business's health at the same time. They're not mutually exclusive. Yes, there are bad ways to drive towards profitability, right? But use cheaper materials and nickel and dime folks, hidden fees. Sure, all those unsavory tactics are out there. And I talk in my presentation on all of the other ways to address profitability without doing that stuff. We don't just cut our way to profitability. So I think we just have to be more candid in talking about this for the dentists listening at study clubs, at dental society meetings, wherever you're hanging out with dentists. It's okay to talk about improving profitability, lowering overhead, and these things. It doesn't mean you're doing so at the expense of your patient's experience and oral health outcomes.
I agree completely. I found it surprising when I first entered the dental industry. I came from restaurant hospitality, selling technology solutions in that space, and moved into dental almost 5 years ago. And like the word revenue wasn't really used. It's like, I know we say production. I was like, oh, okay. And it seemed like there was this avoidance of talking about the dollars and cents of the business portions, and then almost a reputation of the dirty word of corporate dentistry. And like now there's a focus on this. And it's like, no, none of this is actually bad. You can really provide great outcomes for people and still have a very profitable business. And in some cases, I think the most profitable businesses are the ones that are consistently providing the best outcomes. Like they almost go hand in hand, really.
I think that's right. On the corporate dentistry side, it's interesting. So I was chair of the new dentist committee for the ADA roughly around 2010. And this was at a point where there was a significant noticeable rise in corporate dentistry. They were getting into dental schools. The machine was really turned on. Yeah, earliest traces in the 80s and the modern model in the 90s, let's say. But by the aughts, that's when it was really starting to pick up steam. And of course, it's different. Concerns about, is this going to be what happened to medicine? Ultimately, where I landed on this, and I don't want to speak for our ADA's executive director or any leadership in the ADA, but I think where many of them have landed, and I've had conversations with them, is We welcome great dentistry and great oral health providers and people that serve markets, especially underserved markets. And as long as they're taking really good care of patients and taking really good care of the teams that are taking good care of those patients, let the business model flourish. As long as we're doing things ethically and focused on outcomes, I don't really care who the owner is. I often joke when I opened my practice, I had a practice loan from Bank of America. They were ultimately my board that I had to report to. Now, few dentists are able to, with their debt or without debt, open a brand new practice and not have someone that they have to answer to. But ultimately, it's banks and it's corporations and investors that ultimately can hold the purse strings on some of these things. I'll tell you too, I have seen in corporate dentistry, there are folks doing it just incredibly well. Happy patients, happy dental teams, thriving, ethical treatment, all of that. And then I've seen the opposite. I can say the same thing about private practice dentistry or small group practice or any other business model you want to look at. There are people doing it right and there's people not doing it right. And what matters is who's in charge and their ethics, their code, their mission, vision, values. That's what matters, not the size of the group or who they're ultimately reporting to from a financial standpoint.
You mentioned technology a little bit before, and I do want to be conscious of time, so we'll wrap up here in just a couple minutes. But I would love to hear your perspective of what you're excited about from a technology perspective these days. You had mentioned AI. I know both in clinical assistance, and there's all the large language models and the chat GPTs and all of that are out there. But when you're looking at the landscape, what are some of the things that you think are going to be commonplace? And what are some of the things that you're currently evaluating as to determine whether or not it would be right for your business?
Yeah, so certainly 3D printing. I think milling is great. That technology is proven, been around a long time. I know many dentists who are incredibly successful and that'll continue. In the years ahead, there may very well be a point where 3D printing supersedes use of milling, additive technologies being less wasteful than subtractive technologies, fewer parts and pieces. That's a real interesting shift to watch over the next, say, 5 to 10 years. As 3D printing is now able to do more permanent restorations, composites, and ceramic-like substances, that's incredible to watch. And so for dentists either to have this technology in their own practice or to leverage laboratories that are making use of this, that's a fun one to watch. One example is dentures. Now, at Tend, we don't do very many dentures because of our patient population, but for the many practices that are focused on dentures, this is a procedure that had a terrible margin. You couldn't charge enough for a denture to make it have a gross margin that was on par with doing crowns or fillings or anything else. And it's a low margin procedure. Reimbursements for it are dreadful. But that's an example of where if you invest in 3D printing or partner with a lab who's doing so, you can reduce the number of visits. You get a quality product at the end. There's folks who are like August de Oliveira who are really pushing forward on what this tech can do. You're getting really good outcomes and improving the margins at the same time. So that's where you invest in technology, spend some money, and actually recoup the lost profit that was there.
I'm interested on that one. I bought my son for his birthday a couple of years ago a 3D printer. I know this is two completely different things, so I'm not trying to draw the parallel to my son's 3D printer printing dentures, but you use the filament, it prints it out. It's very cool. It's really neat. We load up a bunch of different STL files and we'll throw it out there and we'll see what we can print. For the denture piece, what type of materials are used for the printing in order to provide a solid piece of denture after the printing is completed?
I'm not an expert on it. We're not exploring it right now at Tend. We're exploring 3D printing for other uses. But my understanding is you've got your denture base material that's printed, and then there's the teeth, and they're separate. So you get different quality. And some early concerns I've heard, and someone listening may correct me on this one, but early concerns were it didn't necessarily last as long as a denture than the traditional acrylic materials. However, you can price it accordingly. And when it's done, print up a new one, then reline it to the tissues underneath. So it's a total reimagining of the workflow. And you say it's still high quality. Maybe it's a shorter lifespan, but if it's at a lower price point and there's an ease to make the next one, why not? The other technology, and this is just emerged over the past couple of years, as you know, is large language models. So that I'm really interested in. So yes, AI for caries detection, perio, that's great. And I'm really interested in, as I mentioned before, on how that can improve quality control. Right. So having a practice management software that says what was diagnosed, what wasn't, and then compare that to the radiographs or intraoral camera photos or a scan. giving you a sense of a dentist's ability to diagnose, treatment plan, present treatment, look at outcomes of care. Hey, this filling was done. We know this filling was done 6 months ago or a year ago, and now we're getting a good look at it afterwards. And let's start to track that data. So that is fascinating, but I'm really interested in LLMs. I think there's a tremendous application here, especially for small private practice. I have a team of people in our revenue cycle management department, team of very talented, smart people. A small private practice with someone that is leveraging AI, in particular LLMs, could, under the right circumstances, multiply their output and be able to get the kind of efficiency and the KPIs you'd look at, cleaner claims rate and time to resolution. I mean, they're able to get significant efficiencies thanks to this technology. It's in its infancy. We can't share patient data. We need to have a separate sandbox that's HIPAA compliant. As you've seen, I mean, we're on a weekly basis. It seems like there's strides made forward. Certainly on a monthly basis, tremendous strides being moved forward. So I'm really interested to see how that could positively impact. It's not going to replace anyone. As they say, this is certainly true for dental practice, but for any person, whether you're a graphic designer or a coder or any of these jobs that are concerned about AI is not going to replace you, but someone that does what you do that knows how to use AI will.
Right. I like to think of it as like the extension of human capacity. Like you can just become much more efficient and productive at what you're doing. I view it in much the same way. And I am equally excited. You're right. It's like every day, every week, something new is coming out. I don't know if you're on X, formerly Twitter or anything, but it's like nonstop. Hey, here's a new developer tool for AI. Here's a new tool for communications. Here's these agents that can now book travel for you. It's very neat.
There's a healthy space race going on too with the different players out there. And it's really exciting, driving down costs, improving quality of outputs. Look, when it came out, everyone got very excited and they thought it was an easy button. And of course, then the pendulum swings the other way and you realize, okay, it's not great at math, but we're getting there very quickly.
Absolutely. Last question for you. You mentioned a culture of continual growth. So where do you go to learn? Or do you have any books or podcasts or anything that you'd like to recommend to anyone?
Form your own study group, have your own peers that you respect, and whether you have a book club or, just pick their brains is great. We were talking offline previously about the great people we have in our Rolodex that you meet over the years, and just kind of checking in and pinging them. Our executive team, we meet regularly and we have a book club. We just pick it apart and what can we use, what makes sense. So that's one. Another, it's nerdy, but I do enjoy Harvard Business Review. So I'm a subscriber there. And there's some issues where I'm like, okay, this was light for me. I didn't get anything out of it. But there's plenty of issues where my bread pen is out and I'm like, oh my gosh, this is brilliant. I would recommend HBR to anyone that isn't doing it. You can probably see behind me a whole host of books. I mean, I'm always looking for recommendations on good business books. There's a lot of filler out there, but there's also a good amount of killer.
What was the last book you guys did in the book club?
So it's a book on OKRs, Measure What Matters. John Doerr.
About Google and the implementation of those in Google.
Yeah, Google and the other groups are using it. Real good stuff. That was underlined heavily. Really interesting on objectives and key results, OKR process. Thought it was awesome.
Last quick question. What are you most excited about coming up in the next year, next few months? Just kind of what's getting you going right now?
Aside from what we've discussed in technology, I'm just so excited to go back to dental meetings. It's post-COVID. I've been to a few now. I went to Yankee. I went to Chicago Midwinter, lectured at ADA last year. I feel like they're back in full swing. And it is so great to just reconnect with the network, continue to build a network. We're a social species. And I'm happy to see that many dental meetings are alive and well and coming back full swing. I was just at the Henman meeting in Georgia. I missed it. Didn't realize how much I would miss it. The 2.5, almost 3 years of low or no dental meetings really had an impact. I think probably on sales for a lot of dental companies, but certainly for people like us who want to network and build that Rolodex of experts. That was just so missing from when you could just, shake someone's hand and get a cup of coffee.
Well, thank you so much for joining. I really appreciated the conversation and thank you for the time.
Thanks, Mike. My pleasure.
The Dental Economist Show is brought to you by Planet DDS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. Thanks for listening.